Okay, hi, I'm Sarah Ducharme. I'm a general surgeon at Sora Surgical. Just do a little quick talk today about gallbladder disease. While you're quarantined, you can think of your any symptoms that you may be having that might be attributable to gallbladder. 80% of people who have gallbladder disease have no symptoms. They have gallstones, don't have any idea that they have gallstone disease or any symptoms related to their gallbladder, so you don't need to do anything with that. If you do have any concerns about gallbladder disease or think that you're having some issues, then that's something where we need to get you imaged, get you looked at, and see if there's any of your symptoms could be attributable to that. The people who do have symptoms from gallbladder disease tend to have pain in the mid-epigastric area that goes to the right upper abdomen, can shoot to the back and up to the right shoulder. It usually happens about 15-20 minutes or so after eating. Usually it's precipitated by greasy, fatty foods, but can be any kind of foods. Sometimes can be associated with nausea, vomiting, fevers, or chills. Ominous symptom or ominous signs that go along with gallbladder disease, or if this pain stays, it doesn't go away, you have higher fevers, more persistent nausea, vomiting, the pain persists, and then one of the bad signs can be yellowing of your eyes. Sometimes people don't notice the yellowing of their eyes, so first thing people can notice is like a dark Coca-Cola color urine or white stools. Those are symptoms that, if you have those aren't something you just kind of go, oh, okay, that's kind of interesting. Those are ones where you need to seek urgent medical attention, specifically with an ER. I wouldn't go to an urgent care for those kind of symptoms because they don't have all the modalities that we need to evaluate, and then they don't have surgeons to take care of those. If you notice that you're having kind of every now and then pain after eating, especially if you eat a piece of pizza, not that anyone who goes to the gym would be eating pizza, but if you notice that you have pain up here, or nausea after eating certain kinds of foods, it's a good thing to be evaluated if you have by your primary physician, or you can call us at the Sora Surgical. We're seeing patients in the office and with telehealth if you're concerned about coming in. But be seen by either your primary doctor or come in to see us at Sora Surgical. Oftentimes we'll get some blood work on you to make sure your liver numbers look okay. Check your an ultrasound to make sure that see what your gallbladder looks like, to see if you do have gallstones or if you don't have gallstones, to make sure your bile ducts look okay, and it also gives us a good idea of what your liver looks like. People can have all these same symptoms without gallstones. So there's the two different kinds of way you can have gallbladder disease. One is with anatomic abnormalities with gallstones, and the other is with a functional abnormality where your gallbladder is not functioning properly, but it doesn't have anything that you can see on an ultrasound. So it doesn't have any stones, doesn't have anything that looks abnormal on imaging, but it's just not working properly. If you have gallbladder disease and don't have gallstones, then we generally evaluate you with a HIDA scan, which is a nuclear medicine scan, which can demonstrate how the gallbladder is functioning. And now sometimes people can still have gallbladder issues even if both of those are normal. Sometimes we have to get MRIs or then evaluate you with to make sure you don't have ulcers, which can be another symptom of that can cause another disease that can cause pain in the same kind of area. If you have concerns about having gallbladder disease, you don't necessarily have to have an operation. You don't necessarily need to see someone urgently. But if you're having symptoms that are concerning to you, then coming to see a surgeon or your primary care doctor is very important. First steps to take are avoiding foods that make you have the pain, especially greasy, fatty foods. If you notice that your pains go away with avoiding greasy, fatty foods, then you're probably good. But a lot of times people can't maintain that forever. So if you notice that, gosh, every time I'm doing okay, except when I go out to eat and I get pain, I order in, since you can't go out to eat right now, or when you do takeout or curbside delivery and you notice that you're having pain after eating. Those are things where come give us a call, call the office. We can telehealth with you, we can see you in the office, order appropriate labs and imaging studies to see if it is your gallbladder, and if it's not, then try and figure out what exactly is going on. Gallbladder disease can also cause, gallstones can cause pancreatitis, where you can have really bad pain across the entire upper abdomen. Sometimes that requires hospitalization and can sometimes require having to have your gallbladder taken out. Gallstones can cause blockage of the bile duct, which is the thing that makes you turn yellow. Your eyes turn yellow, your urine changes color. You usually have a lot of abdominal pain when you have a blocked bile duct. And those are things that require more urgent surgical intervention as well. So pretty much that's gallbladder disease. If you feel like you're having any kind of issues with gallbladder disease or anything kind of upper abdominal symptoms, call your primary doctor, come see us at Suarez Surgical. We'd be happy to get you taken care of. A lot of times you don't need anything done, but if you feel like you have concerns, just because you come see a surgeon doesn't mean you're going to walk out of there with consent signed for an operation to be done. So that's what I have on gallbladder disease, and feel free to give us our office a call if you have any questions or anything concerning gallbladder disease. It's 318-3004. Okay, thank you.